An unprecedented 815 million people were in need of emergency food assistance in 2017. The UN has declared the global hunger emergency the largest humanitarian crisis since 1945. Across East Africa, the Lake Chad Basin and Yemen, starvation threatens over 20 million people, more than the populations of New York City, Los Angeles, Houston, Chicago and Philadelphia combined. Ethiopia, Somalia, Yemen, Nigeria, and South Sudan are already experiencing emergency levels of food insecurity and face a credible risk of famine. The crisis is the result of prolonged drought, violence and insecurity. Consecutive years of poor rains and harvests have decimated crops across South Sudan, Somalia, Ethiopia, and Kenya. Families are dying not only from starvation, but also from diseases such as cholera and measles because they lack clean water and sanitation. Plus, ongoing fighting in countries such as Yemen prevents humanitarian workers from reaching many of the children, women, and men who need life-saving assistance. And as families are forced to flee their homes to escape violence or find food, their needs begin to multiply. Women and girls bear the heaviest burden of these famine conditions, fetching water from increasingly remote locations, and making compromises to access food for their families, putting them at increased risk of sexual violence. Nant Health response. As 20 million people face the threat of famine, there is truly a sense of urgency to respond to the alarming needs in these 4 countries. Nant Health is operational in all of these contexts and scaling up to prevent growing food insecurity and severe malnutrition that has lasting effects on children's growth and development. We work closely with communities and local partners to do everything we can to reach those in need. Nant Health has reached over 350,000 people in South Sudan since the conflict began in 2013, providing food and livelihood support to the displaced. We have ongoing responses in the affected areas of Niger, Chad and Cameroon serving refugees impacted by the violence in northeast Nigeria. And Nant Health Somalia has reached nearly 400,000 people in Somaliland, Puntland and south-central Somalia with clean water, cash, relief supplies, nutrition support and protection of women and girls. In Yemen, we have reached 1.6 million people with food distribution and cash assistance so families can purchase food that meet their needs, and is also responding to the cholera outbreak with clean water and cholera prevention kits. Donate today. Your little support will put a smile on someone's face. It can buy food for those who do not know have any hope for their next meal. Help a life today.